Good morning, everybody. Let us begin with general surgery. Surgery is a very important subject, high scoring. If you study well this subject, you can solve the clinical questions very well, and this will help you to score a lot. So, let us begin with number one, treatment of choice for bladder stone. Treatment of choice for bladder stone. What do you think is the treatment of choice for bladder stone? A. Transurethral lithoplexy. B. Percutaneous suprapubic lithoplexy. C. Vesicotomy and stone retrieval. D. Intravenous antibiotics. Intravenous antibiotics. Treatment of choice for bladder stone is the correct option here is transurethral lithoplexy. Transurethral lithoplexy is the most common procedure used to treat adults with bladder stone. For small stone, ultrasound lithotripsy. For large stone, laser lithotripsy. Laser lithotripsy. So the correct answer here is transurethral lithotripsy. So treatment of choice for bladder stone is transurethral lithotripsy. What is the main hazard of ectopic tissue? Testis. It is liable to injury. Liable to injury. Which one of the following is a treatment option for cystosine? Cystosine. A. Anterior colporrhaphy. B. Transvaginal tape. C. Transobturator tape. D. All of them. Traditionally, anterior vaginal wall repair, that is anterior colporrhaphy, was performed vaginally, now replaced by vaginally inserted tape or transobturator tape. So the correct option here is C, transobturator tape. All of them. Best time for surgery for hypospadias is 0 to 4 months, B 4 to 6 months, C 6 to 10 months, D more than 2 years. Best time for surgery is C 6 to 10 months. Which enzyme is diagnostic importance in chronic pancreatitis? It is lipase. Chronic pancreatitis, the enzyme is lipase. Elevated lipase level are more specific to pancreas than elevated amylase level. Lipase level remain high for 12 days in patients with chronic pancreatitis, usually caused by alcohol abuse. Lipase level may be elevated in presence of normal serum amylase levels. Next question. Modified Koch Whipple operation is devised to preserve which part of stomach? It is D. Pyloric antrum. Modified Koch Whipple operation is devised to preserve which part of stomach? Pyloric antrum. The procedure is also called pylorus preserving pancreaticoduodenectomy (PPPD). Pylorus preserving pancreaticoduodenectomy (PPP) or PP Koch Whipple's operation. It is the procedure of choice for most adenocarcinoma of head of pancreas. The original pancreaticoduodenectomy as proposed by Whipple included resection of gastric antrum. The Whipple procedure is now reserved for situations in which the entire duodenum has to be removed, or where the tumor encroaches on the first part of duodenum or distal stomach, and a PPPD would not achieve a clear resection margin. So the correct option here is D, pyloric antrum. Pseudocyst pancreas is developed in how much duration following an attack of pancreas? Acute pancreatitis. D. 4 or more weeks. Pseudocyst typically arises following an attack of mild acute pancreatitis and represents an APC that has not resolved. So the correct answer here is D. 4 or more weeks. True about umbilical hernia is most common content is large intestine. Most of the umbilical hernia disappears spontaneously. Males are affected more than females. So true is most of the hernias disappear spontaneously. Umbilical hernia develops due to either absence of umbilical fascia or incomplete closure of umbilical defect in infants. Umbilical hernia, paraumbilical hernia, is a protrusion or hernia through linea alba, just above or below the umbilicus. Weakest part is the umbilical cicatrix. Contents are greater omentum, small intestine, and transverse colon. Clinical picture. So the correct answer here is B. Treatment of congenital hydrocephalus is A. Ventriculoperitoneal shunt, B. Stereotactic radiosurgery, C. Diuretics, D. Radiotherapy. Correct answer here is A. Ventriculoperitoneal shunt. Congenital hydrocephalus. The treatment options are ventriculoperitoneal shunt, endoscopic third ventriculostomy, lumbar puncture. Lumbar puncture. So the correct option here is A. Ventriculoperitoneal shunt. How much percentage of blunt trauma injuries to spleen in adult currently managed non-operatively? This is a very important question. A. 30%, B. 50%, C. 80%, D. 90%. Spleen is an intra-abdominal organ most commonly injured in blunt trauma to abdomen. Up to 80% of blunt splenic injuries can be managed non-operatively. It can be managed in two ways. Non-operatively, this is now the order of the day. Currently, more than 70% are managed non-operatively, but the primary requirement for is hemodynamic stability. Patients who are hemodynamically unstable or are failing non-operative management, they require operative management. So the correct option here is C, 80%. Which one of the following is false about Jenker's diverticulum? A. Most patients are above 50 years of age. It is the most common esophageal diverticulum. Mucosal outpatching through Killian's triangle. Cervical webs can be associated with Jenker diverticulum. So the correct option here is D. Cervical webs can be associated with Jenker diverticulum. This is false. Rest of them are true. Jenker's diverticulum originates from posterior wall of esophagus in a triangular area of weakness, limited inferiorly by cricopharyngeal muscle and superiorly by inferior constrictal muscle, that is Killian's triangle. Genco diverticulum, also called pharyngoesophageal diverticulum, also pharyngeal pouch, also hypopharyngeal diverticulum, is a diverticulum of mucosa of pharynx just above the cricopharyngeal muscle, that is above the upper sphincter of esophagus. It is a pseudo-diverticulum, not involving all layers of esophagus, seen in 50-year-old. So the correct answer here is D. The cervical webs can be associated with Zenker diverticulum is false. Downhill esophageal varices develop as a result of obstruction of downhill esophageal varices develop as a result of obstruction of A. Portal vein, B. Hepatic vein, C. Superior vena cava, D. Inferior vena cava. The correct answer here is superior vena cava. Downhill varices are produced by obstruction of superior vena cava, which results in collateral drainage from head, neck, and upper extremity venous system into veins surrounding the mid and upper thoracic esophagus. Pantaloon hernia is also called as saddlebag hernia. Pantolon hernia is also called saddleback hernia. It is also called dual or saddleback hernia. This type of hernia consists of two sacs that straddle the inferior epigastric artery. One sac behind the median and other lateral to the vessel. So the correct answer here is saddleback hernia. Rolled up momentum is seen in cases of peritoneal tuberculosis. Treatment of choice for low fistula in ano is treatment of choice for low fistula in ano is A. Fistulotomy, B. Intravenous antibiotics, C. Surgical resection, staged surgical resection, D. None of the above. It is divided into two types, high and low, according to whether internal opening is below or above the anorectal ring. The importance of deciding whether a fistula is a low or high type is that a low level can be treated by fistulotomy without causing damage to the sphincter. So low fistula is treatment of choice is fistulotomy. Colonoscopy. Colonoscopy are not indicated in A. Meant to be, B. FAP, C. HNPCC, D. Cronkite Canada syndrome. Correct option is A. Meant to be. Meant to be does not predispose to colon cancer. FAP, familial adenovirus polycyst, HNPC, Cronkite Canada syndrome, predisposed to colon cancer. So the correct option here is A. Meant to be. Colonoscopy is not indicated in meant to be. Simplest investigation to be performed in suspected cases of gastric cancer is CT scan. Investigation of diagnosis for gastric cancer are ultrasound and CT scan to rule out secondaries in liver, to look for enlarged celiac nodes, can detect ascites, guided fluid tap and cell cytology, to detect Krukenberg tumor, pelvic CT, used in detecting metastatic disease. So correct answer here is CT scan. Plunging ranula is A. Cystic growth of sublingual gland, B. Lymph node, C. Tumor in the floor of mouth, D. None. Correct answer here is A. Cystic growth of sublingual gland. Plunging ranula is a rare form of mucus retention cyst that arises from sublingual salivary gland. Mucus collects below the gland and perforates through mylohyoid muscle diaphragm to enter the neck. So the correct answer here is cystic growth of sublingual gland. Most common site of direct hernia is A. Hasselback triangle, B. Femoral gland, C. No side predilection, D. None. Correct option here is A. Hasselback triangle. Treatment of contaminated wound of leg is debridement and antibiotics. After debridement, wound is reassessed and further managed. Depends on type of wound. If it is small and clean, primary closure can be done. If it is large and clean, coverage procedure should be done. If it is still contaminated, daily dressing and debridement is done. Correct answer is debridement and antibiotics. Most important diagnostic feature of congenital hypertrophic pyloric stenosis is non-bilious vomiting. Metabolic alkalosis also occurs. Non-bilious vomiting is the most important feature of CHPS. Gallstone impacted causing intestinal obstruction is C. Gallstone ileus. Hemorrhage after thyroidectomy is due to superior thyroid artery.